that has taken the time to learn more about our academic programs as well as the center here. My name is Andres Colmenares. I am the graduate marketing and recruitment specialist here at the Center for Arts and Medicine. I'm joined today by Ferol Carytsas, our wonderful director and leader of the Center for Arts and Medicine. Ferol will be stopping by later on this presentation to discuss career programs and career outcomes for our programs. But the bulk of this conversation will be discussing the academic programs here at the center and how you can earn a degree in arts and medicine here at the University of Florida. So I'm going to go ahead and get started here and walk through the agenda items of what we are going to be discussing today. So we're going to touch briefly on what is arts and health. I know that a lot of the participants here in this presentation are at least familiar or aware of what arts and health is and what the field consists of. But I still want to go ahead and talk a little bit about what the field entails so that everybody in this presentation is better aware of arts and health and how it relates to what we do here at the center, which is the second topic that I'm going to be discussing, is what it is that we do here at the center, the faculty members in the center, and how we envision the field of arts and health growing as key leaders in this field. Then I'm going to go ahead and talk a bit about why you should take programs and study with us here at the center. What are some key benefits that we provide to our students, and what can you take out of any program that you decide to take? We have multiple programs, multiple graduate programs that we offer to our students, and each can provide key benefits after graduation, whether that is our certificate programs or our full Master of Arts programs. And we'll be discussing the key benefits as well as go into details of each of our programs later on in this presentation. And then finally, Farrell will be talking about career pathways that you can take with a degree in arts and health and what you can do with being educationally credentialed in the field of arts and health. And we're going to end it up with questions using the Q&A section. So Farrell is in this call right now and will be answering questions that are put in the Q&A section. And then in the actual Q&A section, we'll go through and answer any remaining questions. So if you have questions now or questions during the presentation, please put them in the Q&A section and we'll do our best to answer as many questions as we can. We might be able to finish a little bit prior to an hour for this presentation. So we'll make sure to answer as many questions as we can towards the end to make sure that you are all set with our with anything regarding our programs. So let's go ahead and get started on what is arts and health. So in the purview of the center, the field of arts and health is an interdisciplinary field where the arts and creative engagement are used to support health, healing, and well-being in hospitals, communities, and public health settings. This field, I think, is incredibly unique because it is one of the very few fields that brings together artists, healthcare professionals, educators, and researchers all together with the common goal of improving lives through creative expression. The general consensus of this field is to promote creativity and promote artistic modalities, not necessarily just as a cultural asset, but a vital part of the overall holistic health of humanity, akin to brushing your teeth every day, exercising, and eating your vegetables. It is just as important to your health as other health outcomes and the engaging in creative fields and engaging in the arts is just as important for that. So some practices in the field include artists working in hospitals or clinics with patients and staff. Later on in this presentation, I will be talking briefly about Shan's Arts and Medicine, which is our sister program here at the University of Florida, who houses artists and residents who on the daily go and work with patients and engage with patients using different artistic modalities and how it is that they work in the hospitals and in clinics. It also looks as community arts programs that are designed to support mental health and reduce isolation. We also provide practices in arts-based public health campaigns or storytelling initiatives. And the field also explores the impact of arts on health outcomes and systems. So that being said, what is the Center for Arts and Medicine, and what is that we do here at the center to help push, promote, and advocate in the field of arts and health? So we are one of the key leaders of the field, and our goal is to build and train in the field of arts and health. We provide local, national, and international leaders in education, research, and practice, all at the intersection of arts and health. We are committed to advancing research, education, and practice in arts and health locally and globally. And that looks and how we practice that is different amongst all the work that we do. But specifically with our academic programs, it is very important to have an international perspective with our programs as well. And I'll talk more about what that means when we're talking about our academic programs. But one of our main vision for the field is that arts, culture, and health are integral partners in the realization of healthier, more equitable lives for all peoples everywhere. We also, again, collaborate with our sister program at UF Shands. The program is called Shands Arts and Medicine. Shands Arts and Medicine is the oldest hospital-based arts and healthcare program in the entire nation. And in fact, some of the faculty members who teach our academic programs also work at UF Shands Arts and Medicine, and all of our faculty members provide their unique experiences working as an artist in residence at Shands. We also provide research labs and explore the arts and cultural engagement through research with our EpiArts National Endowment for the Arts Research Lab. The purpose of the lab is to build on research conducted in the UK to investigate the impact of arts and cultural engagement on population outcomes in the United States. We are also a national leader in advancing arts prescribing here in the US, conducting foundational research, shaping policy conversations, and supporting the integration of creative practices into health and community care. And this is through partnerships, research, and evidence-based advocacy with organizations like Americans for the Arts, Arts for Everybody, the National Endowment for the Arts, and it's allowing us to help build a case for prescribing the arts as a tool for health, connection, and well-being, which goes back to what I discussed about what we want out of the field of arts and health being an important and very, very valuable tool in bettering the health of humanity. Also, our faculty and researchers here at the center have worked alongside the CDC, the World Health Organization, the NEA, Arts for Americans for the Arts, and other health-focused organizations. And our work has been featured by the New York Times, PBS, NPR, CBS Sunday Morning, and a lot of major news outlets. So if any of you all have heard from us from those news outlets or from our research, that's something that we are extremely happy, and we are so glad that our work has been transmissioned through international aspects. So we're getting our word out there, and hopefully more people decide to come and join us to better the field of arts and health. So, one of the things that I wanted to discuss with you all today is why consider studying with us. You know, I did mention that we are the key leaders in the field of arts and health, but what does that mean from your perspective if you wanted to gain an additional educational credential, or if you wanted to learn more about how you can get involved? What are some of the ways that you can do that? So, one of the ways that we offer this for everybody is through our graduate programs. We offer three distinct graduate programs that each all provide flexibility and accessibility for our students. So, whether you want to have a full graduate degree or say a certificate that expedites or accelerates um, getting an educational credential for whatever situation that you're in. We want to provide as many options as possible for you, as well as much more accessible ways for you to be able to get your education in the field of arts and health. Our courses reflect the latest research and best practices in the field, and it also prepares students to engage with patients and communities through the arts as well as through research. And that looks like providing hands-on learning with a healthcare or community site in your local community. That also looks at global research and outreach projects and community-based practice and public health initiatives. So one of the key aspects of our program that we have intentionally provided to our students is that our each and every one of our programs are flexible and it's all fully online and asynchronous. And that allows our students to study from anywhere in any form in your own schedule. So if you wanted to take the courses anywhere around the world and do it at your own pace, we allow you to do that. So um, if you don't have a lot of time one semester but have more time the next, our programs are built specifically to help you get from point A to point B with our programs. As long as you complete your deadlines for the semester and, of course, take in the material as you should be able to complete the certificate or the degree at your own pace. We also provide practice-based and research-informed curriculums that will provide theory, research, as well, and more importantly, applied practice. We wanted to ensure that you get the experience of not only learning about the field, but also how can you practice it in a community or healthcare setting. And we want to provide those opportunities to you so that you can implement these arts and health projects in your own community, whether that is through our practicum or through any of our course materials that we offer. So one of the other aspects of our programs that we are especially proud of is the leaders that we have in our faculty. So this is faculty coming from all over the world that are recognized nationally and internationally. And each of our faculty members provide decades of experience in clinical, community, and global settings in relation to the field of arts and health. In fact, this past semester, this spring 2025 semester, three of our faculty, Tina Mullen, Cassie Belden, and Kelly Sams, were all recognized by our associate provost for having excellent teaching evaluations for the semester, which reflect the dedication to student success. Innovative teaching strategies and their commitment to academic excellence. So, not only are our faculty being recognized for the work that they do in the field, they're also being recognized for the work that they do in the classrooms, which is extremely important for all of us. Our programs also provide interdisciplinary training. What's great about our programs is that our programs are open to every student, regardless of whatever academic or professional background you come from. We always encourage students to have a base understanding and a base foundation of the field of arts and health, but our programs also allow in educating and providing more information for the field so that you are well equipped and well prepared to work in healthcare, public health, education, research, and the arts upon graduation. We also provide community-based learning through our practicum and our courses in our curriculum. We allow students to apply what they have learned and directly incorporate what they have learned into their community through our hands-on projects. So one of the reasons why we allow students or why we have our programs be fully online is so that students who are taking their programs wherever they are in the world, they can implement what they have learned into their own community settings. So that allows the field of arts and health to expand to places where they may not have even ever heard of what arts and health is, or when they hear what arts and medicine is, they said that's a thing. Like that's something that is something that is important and that is intentional. That is by design with our programs. So students don't necessarily just study theory or study what the field is, they also get to put it in action through research, through program development, and through implementation of actually being hands-on in the field. And our programs provide real-world impact and global opportunities. Our programs allow students to gain practical experience working with patients and community members in clinical and public health settings. And we also provide students access to national and international research, outreach, and collaboration experiences. So I want to go ahead and talk about our flagship program, which is the Master of Arts in Arts and Medicine. This is the, again, primary program that we offer. This is a full graduate Master of Arts program, and it's a perfect fit for both artists and healthcare professionals. Again, I had previously mentioned that this is open to anybody regardless of your background, but this is perfect fit for artists who are interested in finding ways to expand their palette, so to speak, on what they can do with their art, as well as healthcare professionals who are interested in learning new ways to better the health of humanity through creative practices. Our curriculum covers practical skills and knowledge necessary to safely and effectively engage in arts and healthcare and community environments. And with this program, students receive education taught by accomplished leaders at the forefront of this field. Again, I've discussed the many accolades that our faculty have received, as well as their care to both the field and through what's going on in the classroom, and the education that students receive from the Master of Arts program and any of our programs actually is probably the highest tier that you can receive in any sort of Master of Arts degree, not necessarily even here at the University of Florida. Skills that develop professionalism in the discipline of arts and health. And we also offer a practicum that allows students to work in their local communities, which is the experience-based courses that I was talking about previously. So the Master of Arts in Arts and Medicine program provide courses in program design, evaluation, and practice. The program also provides seminars to enhance professional competencies, and students get to design and implement their own arts and health project and work alongside our faculty to work one-on-one to refine this project before, during, and after implementation. We also provide a lot of electives that tailor to the studies that we provide in our program, but also to student-specific passions. So some of the electives that we offer involve compassion and creativity, healthcare environments, interdisciplinary collaboration, leadership in arts and health, and a lot more. If you schedule a time to chat with me after this presentation, using the links that I will provide towards the end of our presentation, I can go into detail on the curriculum and share more about what it is that you will be accomplishing should you decide to pursue an MA in arts and medicine. And now we're going to talk a little bit about the logistics. So for the Master of Arts in Arts and Medicine, it is 35 credit hours to complete, depending on whether you are you work full-time, or you want to pursue a Master of Arts full-time or part-time. It can be completed in about 2 or 3 years. And that includes everything that we can offer in relation to our curriculum, which is core courses, electives, and the final capstone project. The tuition is roughly $25,000 in total for the 2 3 years, all 35 credit hours. And what's great about it is that it does not matter if you are in state at the state of Florida, since we are based in the state of Florida. It doesn't matter if you're in state, out of state, or international. The tuition rate is flat for everyone. So it provides a lot of accessibility, regardless of where you come from and where you are in the world. And what's great about our programs is that the University of Florida provides financial aid and scholarship options for you if that is something that you want to pursue. And if you have any questions about that, or are interested in pursuing any sort of financial aid or scholarships, scheduling a time to chat with me about the program, we can find what works best for you so you can help secure funding for your education. But if for whatever reason you are interested in any of our programs but require an accelerated option for earning a professional credential, we also offer graduate certificates in both arts and medicine and arts and public health. And these are like I mentioned, they're accelerated options. They're not going to take as long as the arts and medicine, the full Master of Arts in Arts and Medicine program, but there's still ways for you to earn a professional credential. Say if you require one for work or require one for a new job position, we have graduate certificates that can help with that. So again, there are two programs that we offer: the Arts and Medicine program, which is designed to design and facilitate arts and health programs in clinical and community settings to enhance health and well-being. It also provides opportunities to collaborate with healthcare teams to support patient care, and it gains foundational knowledge in arts and health practice, theory, and ethics. So the graduate certificate in arts and medicine is a shrunken version of the full Master of Arts program. You're going to notice that the curriculum is very similar to the full Master of Arts and Arts and Medicine program, but it is a little bit it is condensed, and you won't be taking all of the courses to complete this graduate certificate. There is a difference with the Arts in Public Health graduate certificate since it has a primary focus in public health, and it integrates the arts into public health messaging, research, and practice. That's what the curriculum is mostly focused on. It addresses public health challenges through creative community engagement, and students get to design art-based strategies for health promotion and behavior change with this program. So a little bit of logistical information for both our graduate certificates. The Arts in Medicine and Arts in Public Health programs both are 12 credit hours each. The Arts in Medicine graduate certificate can be completed in 3 semesters, while the Arts in Public Health can be completed in 3 or 4, again, depending on workload and how much you're able to accomplish based on whatever you have going on personally. It can be completed in about 3 or 4 semesters. For the Arts and Medicine graduate certificate program, it includes just the core courses, while the Arts in Public Health includes core and public health specific courses, which makes it a little bit different than our Arts in Medicine graduate certificate and our Master of Arts in Arts and Medicine. The tuition for the Arts in Medicine graduate certificate is $8,079.84. And for the Arts in Public Health, it is $7,119.84. Again, this is flat tuition rate regardless of where you are, whether you are in state or out of state or international. Every student pays the same amount for tuition. All right, so now I'm going to go ahead and pass the mic to Ferol to discuss the career pathways in arts and health and what can you do after you graduate with one of our programs. So Ferol, take it away.
Thanks, Andres. Hello, everyone, and thanks so much for joining us. It's so exciting to see so many different geographical locations represented in this call. So one of the aspects about arts and health that I love the most is how interdisciplinary the field is and how many pathways exists. Our students come from a wide variety of backgrounds: arts, public health, medicine, nursing, community and nonprofit organization leaders, just to name a few. So there's many different entry points into arts and health. And so when we start to talk about the career pathways, we have a tendency to put them into four buckets or four categories, and that's administration. So for example, a program manager for an arts program at a hospital, education, teaching courses in K through 12 or higher ed, research, designing and implementing research in partnership with collaborators. That could also look like data collection, data analysis. There's a lot of elements of research that are possible. And then we talk about practice. So if that looks like facilitating an art practice at the bedside, doing workshops in hospitals or community to support, either both patients and caregivers in the hospital setting, and then as well as community members when you're working out in the community. Next slide, please, Andres. So in addition to the, when we start to think about the career pathways, we also have community arts and health facilitators who lead arts programs in community settings to improve public health, reduce isolation, and promote social cohesion and resilience. We have arts and public health specialists who design and implement arts-based public health initiatives to address health equity, prevention, and social determinants of health. And we have policy advocates, those who are promoting funding and integration of arts and health at local, state, and national levels through advocacy and policy work. And I'll just make a note. I feel that anyone who's working in the arts and health field is already an advocate. So I think that advocacy is something that crosses over all the different pathways that exist. Next slide, please. So I wanted to take a moment to talk about our Arts and Health Intensive. So this program holds a really special place in my heart because it's where I first discovered the field of arts and health. And I came to the program knowing nothing. And what I loved about the program was that it's in this cohort design and it's designed for all levels of experience. So was in with people that also didn't know that much about arts and health. And then I was in with the cohort with people that had years and years of experience. So over the years, our Arts and Health Intensive has evolved, and this year we're really excited to be able to offer a 3-day interdisciplinary arts and health training that will have two tracks. One administration that will be led by Tina Mullen, who's Director Emeritus of UF Health Shands Arts and Medicine, and we'll have the second track, which will be practice, will be led by Jenny Lee, who's a master lecturer with the Center for Arts and Medicine and is the director of the UF Health Shands Arts and Medicine program. So this year's intensive will be held in fully on campus. There will not be a hybrid or online portion component to this year's intensive, and it will be in Gainesville, September 2nd through 4th. And I think on the slide, I'm seeing it right now, there's a special code. If you're interested in participating in the intensive this year, there's a discount. So make sure you write down the code if you're interested in learning more. I'll also just take a moment to remind everyone, if you have any questions, please drop them in the Q&A function at the bottom of your screen, and we will do our best to answer any questions you might have. I'll pass it back to you, Andres.
Yeah, thank you so much. I'm going to leave this slide just for a few more seconds so that you all can get the code info session. Again, this is a code specifically designed for each and every one of you. As you learn more, and I can provide resources once we finish this presentation and send out the presentation and information to you, we'll also send the sign up link for the Arts and Health Intensive. And as you're going through the checkout page, there's going to be a code. If you use the code info session, you will receive early bird pricing that is not available for everyone else. So thank you so much again for getting into this presentation and learning more about our programs. And this is our way to allow you to get a little extra benefits for joining this presentation. But now I'm going to change the slide and leave it open to questions. So please go ahead and utilize the Zoom Q&A feature like Ferol said. We'll do our best to answer questions as they come in. If you want to stick around here and listen to the answers that we provide, but don't have any questions yourself, I would really appreciate if each of you can scan this QR code to complete a very quick 5 to 10 minute survey about the webinar, feedback about the webinar, but more importantly, ways for us to connect. So there's going to be a question to ask about whether you want to receive follow-ups about our programs, and I will personally reach out to you to answer any questions that you have, as well as schedule a quick virtual call via Zoom so that we can have a conversation about the programs and how it could be a program that's a fit for you. So I appreciate the virtual calls because it can be very personal since everybody has a different background, a different situation that they are in. And I want to make sure that each of our calls are personalized for everybody who comes in. So please take a moment to take the survey if you are able to. All right, so I'm going to go ahead and jump into the Q&A. So the first question that is being asked is there a way to do some on-campus practice and study through UF or study at UF through the MA in Arts and Medicine? Farrell, I see you typing. I don't know if you want to go ahead and take that one.
I was gonna say, it's faster for me to respond than type. So, Lauren, thank you for your question. So yes, the practicum experience, there is a possibility of doing your practicum experience at UF Health Shands Arts and Medicine. But the program, the coursework itself is all still fully online asynchronous. So, but there are sometimes opportunities for students to participate in our clinical program as part of the practicum experience. And that's definitely something to discuss in the application process and as you're learning more about the program. Thank you for that question.
Mhm.
Is another question. How is UF navigating funding and sustainability for arts and health? It's a great question. So we all know, things are very interesting right now, but so far we are doing very well and we're exploring funding opportunities externally as well as continuing to receive support from both the university and the college. So as you know, it's an actively evolving situation with funding at the national level, but we remain optimistic and are and watching it closely. There's some additional questions actually in the chat. One of them
Yes.
is, are there less job opportunities for those that don't have bachelor's degrees in arts and medicine? Mine is in radio television. So to my knowledge, there are no bachelor degrees in arts and medicine in our country. So there is not a disadvantage to not having a bachelor's in arts and medicine. The expectation is that, like I said, you enter in with multiple, we have all of our students have multiple entry points and backgrounds, so not a concern at all if you do not have a degree in arts and medicine at the undergraduate level. Another question about portfolio. Can you talk more about the portfolio? Sure. So our application process requires a portfolio. And what that basically is just a collection or sample of your work. So let's say you are a musician. Maybe it's submitting some audio clips, 2 to 3 audio clips that showcase your work. If you're a dancer, maybe you submit short videos of your choreography. If you're a visual artist, maybe you submit a few images of your artwork. If you're more on the administrative side, sometimes that looks like you can submit articles that you've written or research that you've been involved with. So the portfolio is really designed to showcase your specific modality and skill set. There aren't a lot of parameters around what we expect, and every portfolio looks different. So it's really tailored to what your expertise are.
Mhm. I'm going to hop in a little bit about the portfolio. Um, if you submit the portfolio and the email that I provide in the final slide, so after this, I'm going to share more about how you can schedule a call with me so that we can chat about the programs one-on-one. If you send the portfolio out, we can ensure that the file and any technical aspect of the portfolio is good for our admissions committee. We won't be able to tell you if it's a strong portfolio or not, but we are able to review to make sure that it is accessible. We can read it, we can see all the information. So then that way you're still in the loop in making sure that the documents that you provide and submitted are able to be shared and reviewed by our admissions committee. So that is a question that we get sometimes because sometimes portfolios can be very complex in nature, and we want to make sure that we obviously accept all of that and we encourage that, but sometimes there might be a technical aspect that can prevent something to be viewed, so we want to ensure that that is being considered.
We have another question in the chat. How competitive is it to get into the program?
Yeah, so I'll go ahead and I'll take this one. It is a very competitive program. We try our best to encourage or to accept students who not only have uh, a strong interest in the program, but also a strong interest in the field, whether they are fully familiar with what's going on in the field and have engaged in research or have engaged in the work themselves in their career. but also students who may not have a full foundation but are still want to be advocates into the field. I know that Ferol had discussed that even having any interest in the field is already advocacy in itself. And we want to encourage that for each and every one of our students because of how much in-depth experience and participation that you'll be going through during the program in the field. We want to make sure that we are accepting those who are extremely passionate and also willing to be open-minded and learn more about the field. So we want to be mindful of not just accepting everybody, but also being ensuring that the students who are interested in our programs are going into this field with the open mind and advocacy that we're looking for. Pharaoh, do you want to take the question in the Q&A?
Sure. So the question is, hello, and thank you for this info session. With current federal budget cuts affecting both the arts and public health, how is the program adapting to help students understand the future of work in this field? Specifically, how can we trust that there will be opportunities for us, and what impact should we anticipate? That's a good question. So,
Mhm.
I think we all acknowledge that there's a lot of uncertainty, but one of the things that is keeping me going is just the recognition and the understanding that we're seeing that the arts really do impact well-being, and the national momentum that is still taking, that we're still seeing, I'm finding very encouraging. So, I think one of the elements of our, of being in the field is adaptability. And I think being able to adapt to the current situations is critical to being in the field right now. And so in terms of, I think it requires a little bit of adaptation and flexibility in terms of thinking through what is possible and how we're going to adapt. It's a difficult question to answer because we're in the moment right now and we don't know what twists and turns we'll receive or, see. But I remain optimistic that there will continue to be opportunities, especially because there's such momentum around social prescribing and arts prescribing. And I think that we're seeing more and more institutions and organizations really lean into that idea. And so, again, I think we're going to see a surge of interest in the arts. And as arts and health facilitators, practitioners, I think we are kind of on the ready to be, to address and be able to manage whatever comes our way in terms of what our communities, the communities need in terms of that.
Yeah, thank you for that question. I know that, especially right now, it is a very, very hot topic, and we want to ensure that we continue in providing the best in education, the best in research, and the best in advocacy for the field, regardless of what is going on um, in general and in the world. All right, so there is another question in besides the MA and professional programs, are there PhD opportunities with UF? Um, I'm gonna give this one to Farrell as well. It seems that you're excited for that question.
I'm so excited for this question. So, we are in the process at the center of developing the first in the country PhD program in arts and medicine. So, we're probably looking at about 2 years away before before we're actually able to offer the program, but know that something is in the works, and I'm looking forward to being able to make an announcement, hopefully in the not too distant future, about being able to offer. Um, the PhD. So there's another question in the chat. Sure. So something that would add value to this presentation is dedicating a few slides to highlighting where alum of your program are now and how they're putting their degrees to use. So we have alum all over the country, and I'm going to be sensitive and not divulging identifying information because I don't know that I have permission from everyone. But we have alum that are leading major initiatives in arts organizations. We have alum that are working as program administrators in hospitals. We have alum that are working, doing like policy and advocacy work, working very closely with policy. We have alum that are leading really big research initiatives and authoring and reporting and sharing their findings, which is really exciting. And we have a lot of alum that are artists facilitating in their local communities. So facilitating, arts programming in clinical settings and in their communities. I know that's vague. I'm happy to provide more information once I have permission to divulge an alum and where they work.
Yes, you can reach out to us and we can provide that information as we are available to share it. There is another question in the chat. Can I start one certificate program but then switch to the other? And the answer is yes. What's great about it is that, for example, our arts and medicine graduate certificate, the curriculum is very similar to the full Master of Arts program. So if you were to take some courses in the graduate certificate or even complete the entire graduate certificate, you can transfer the credits that you've earned in the graduate certificate into the full Master of Arts in Arts and Medicine program, and get a head start into that program so that you can finish the program faster. And if you wanted to take it later on, it'll also be a little bit more affordable as well because you'll be paying for fewer credits since you've already accomplished them. So yes, you can transfer from one to another. And we actually have a lot of students who do that since one day they'll say, I just want a quick credential. And then in the future, they're like, I want to go head on with this Master of Arts program. So I appreciate that question. That is a great question. And I'm really happy to share that with you all.
There's
All
another
right.
question in the chat. It
Mhm.
was mentioned a lab for research through Endowment of the Arts in the UK. Can you explain a little bit more if possible? So I'll do my best. Basically have two labs. We have the Epi Arts Research Lab, which is the one that you're probably familiar with and is working with the University College of London. Um, and that lab is looking at epidemiological studies and how the arts impact culture. And then we have our interdisciplinary research lab. And that lab is where our faculty, all of our faculty have the opportunity to bring their research into the lab. And so then students have the opportunity to work with faculty members, learning research methods, sometimes being published authors, doing data collection, doing data analysis, doing lit review. So there's a lot of opportunity in that regard in terms of being involved with um, our research labs. There's another, oh, I see that Andres is typing
Yes.
the answer, so I will let you respond.
Yeah, so unfortunately, the EEP program at the University of Florida, the Employee Education Program, does not cover certificates or the full Master of Arts program. In this situation, if you're still interested in our programs, Wendy, I will recommend that you reach out to me directly and we can find ways to help in either through scholarships or any sort of other financial avenues to help out with this. But no, unfortunately, the EEP is only for is not available for our programs at this time. Farrell, there's a question in the chat. Do you mind getting that one?
I am reading it. So the question is, could the arts and public health certificate help me gain the relevant skills? I did notice the curriculum covers theory, research, and applied practices. What could a practicum or capstone project look like if I'm coming in with previous knowledge and experience with a specific plan? Thank you for that question. So
Mhm.
one of the things that I think is really neat about our master's program is that um, every capstone project or practicum looks a little bit different because it's really intended to be tailored to your interests. So you come in and you identify, I'll make something up. You come in and you identify that you want to work with individuals with dementia and you're a musician, and someone else might come in and say, I want to work with individuals with Parkinson's and do dance. So everyone's practicum and capstone is a little bit different and it's really tailored to your interests. So you get to self-select how you want to proceed. And it's sometimes students come in with very specific plans and know exactly how they want to proceed. And others, they develop and evolve as they proceed and go through coursework. So definitely welcome coming in with previous experience and but also not a requirement. There's another question in the chat. Do a lot of people who get the certificate get a job in the field and then pursue the master's? It's not uncommon for students to continue in the program and get their master's degree. Obviously, what I will say is that the certificate provides the like basic competencies and demonstrates to employers that you have training and skill and have gone through a training program. The master's is always going to carry more weight in the field because it's an advanced degree. But that's not that we have several certificate students who have been very successful in getting positions. So it's not an either or, but just know in the field, advanced degrees always will carry a little bit more weight than the certificates do. There's
So
an
there's an yeah, I'll take this one. Are there certain qualifications you look for in students when potentially accepting them into the programs? So again, it goes back to what I had mentioned previously in a previous question about um, open-mindedness and advocacy. And you'll notice in our How to Apply page that I'll also be sending out to everybody in this call, and it will also be in the next slide. A link to that is. There's going to be different materials that you'll need to submit in order for you to apply to the program, and that involves a personal statement and a personal letter of the program. We want to ensure that students who are applying into the program are invested in the field and are interested in learning about what it is that's going on in the field and opening their minds to different experiences and ensuring that health is our arts are viewed as a positive health outcome for individuals and for humanity. So the only thing that we truly require is ensuring that the application is strong in relation to showing off your interest in the field, as well as indicating any sort of art or I've seen art portfolios as well as portfolios talking about different courses or different classroom activities that students have done. As long as you show off a strong application in relation to the interest in arts and health, I think that that's probably the strongest qualification that we look for in our students. Farrell, do you want to add anything else outside of that?
I think you covered it. Thank you.
Perfect.
Practicum question. So when selecting the area of interest for practicum, do you assist in finding a place to practice, for lack of a better word?
Mhm.
So it is the student's responsibility to identify their practicum site in their community. But what students do is they submit a proposal form to the faculty, and we help guide you through that process. But it's up to the students to identify and find their practicum sites.
And to piggyback off on that a little bit, what we appreciate about having this program be fully online is if you are currently working or interested in working at a local hospital or at a local community center, it this program allows it to be the catalyst to engage in that conversation and begin that partnership with the local hospital or local community. And it also opens up opportunities for you to be able to work with them without the need of specifically focusing on whatever the University of Florida provides, instead of it being siloed into just the specific Hospitals, it allows you to work with any hospital. There's not as many restrictions. In fact, I don't think there's any restrictions outside of it being just a hospital or a community center to practice arts and health, which again engages others who may not have been familiar with the field in general. And it allows us to continue increasing the exposure of the field. So it's actually something that by design is helping the advocacy work for the field. So yes, it will be the student's responsibility, but there's also opportunities for our faculty to help in that regard. So yes, thank you for that question.
And I'll also add, at one point we did a survey and we found that 80% of our students got a job offer from their practicum site. So know that like oftentimes we advise students to think through where you think you might want to have employment in the future, because oftentimes sites are so impressed and so excited by the work. They sometimes, not always, no guarantees, but will often offer positions after outside of practicum. Andres, I wonder if we should advance the slides so people
Yes.
can, okay.
So I'm going to go ahead. If there's any last minute questions, we'll go ahead and we'll answer it. But I wanted to thank each and every one of you, especially you, Ferol, for helping out with this presentation, but also for attending this presentation. I really hope that one of you or any of you learned anything new about our programs. Again, if you want to reach out to schedule a chat with me, the email is over here at camadmissions@arts.ufl.edu. You can schedule a virtual call with me based on the schedule that you have. When you scan that QR code, it's a Microsoft Bookings link. If you're not aware about Microsoft Bookings, is that it shares my calendar so we can find the right time that works best for you and me. So it removes the headache of trying to find the best time for both of us. If you are interested in wanting to start an application or learn more about how you can apply, there is another QR code at the bottom, which gives you access to our How to Apply page that allows you to learn more about what materials we're offering. If you have questions about the portfolio, if you scroll at the bottom, there is a tiny Q&A section or a frequently asked question actually about each of the materials that you will need to submit. And if there's any other questions that you have, there's also a link that will take you back to scheduling a call with me, and I will personally work with you on ensuring that you can submit an application easily and accessibly. You also, one of the things that I recommend everybody that I speak to is if you are interested in engaging in the work that we do, but you're not sure where to start, a really quick, easy, and free way to do so is following us on social media. We are very active on social media and we are constantly sharing current research, program opportunities, scholarships, and any information about the field, but also that's coming out from the center itself. We post on our social media, and we have a lot of different options for each and every one of you. The final thing I want to talk about is the application deadline. If you are interested in getting started with us for this fall 2025 term that starts in late August, the date escapes me, but I know that it's sometime in late August. The deadline to submit an application is July 1st. Because it is so close, it's only like a month away, and it is a huge decision to make to if you wanted to engage in either a graduate certificate or a full Master of Arts degree. We are providing grace specifically to you all in making sure that as long as you submit an application by July 1st, any additional materials, say for example, you're waiting for somebody to write a letter of recommendation, or you're still trying to finalize your portfolio, we are still accepting applications, but require that every student submit all of their materials by July 15th. So that is information that we are providing you all so that you all can have a little bit more flexibility in providing a full and strong application, especially with the deadline coming so close. So I want to thank each and every one of you for taking the time to listen to us chat about our academic programs. I really hope I get to connect with each and every one of you about this program. This is a very special program and a very special field. And whether you decide to take an academic to pursue an academic program with us or continue to work in the field, as long as you are an advocate for this program and for the field of arts and health, that's all that we could really ask for and we all advocate for. So thank you so much again for taking the time to watch through this presentation. Thank you so much.